So the next drug was mefenamic acid, also known as mefenamate, right? So let's start with dosage of mefenamic acid. Mefenamic acid ranges from some about 250 milligram to about 500 milligrams, and you can give every 6 to 8 hours, right? And max dose is about 1.5 gram per day, right? So 24 hours, every 8 hours is about 3 times, so 5 times 3 is about 1.5, right? So like this you can even calculate for every drug, right, how much should be the maximum dose, right? The mefenamic acid is very nice drug for the females, right, because it can help us to tackle the pains, right? So we are over here at number 14, right? Mefenamic acid, it has a very good analgesic property, it has a very good antipyretic property, right? And it also moderately help for the inflammation, right? However, there is still a risk for the GI bleed, right? So we were talking about the mefenamic acid, right? Now time to talk about the dosage. We're done with the dosage. Let's talk about the onset of action, right? So onset of action is again 30 minutes, just like other NSAIDs. Peak, again similar, somewhere about 2 hour. Duration of action is about 4 to 6 hour. And GI risk, okay, if you exceed this limit, 1.5 gram per day, right? That is, if you are consuming like 500 milligram tablet of mefenamic acid, you can have up to like 3 tablet in a day, or 3 at once, right, in a day. If you exceed more than that, you will have a higher risk of GI bleed. Right, so indication, right? For the indication, it is used for dysmenorrhea, painful bleeding during the periods, musculoskeletal pain, musculoskeletal pain. You can also use it for dental pain. Actually any sort of pain, right? Because as per the coverage, it was right. It was a good analgesic property, right? Right, now let's talk about its composition with the other drugs, and also the different types of mefenamic acid available in the market. So it starts with the meftal, right? So mefenamic acid is mefenamic acid, right? It is available as two major type: meftal 250 mg or meftal 500 mg. Next is Ponstan. Ponstan is also again same, so not to focus more on that, but there is combination of the mefenamic acid, right? The different combination you can see, again mefenamic acid is for meftal, so they can be meftal p, meftal spas, and so on. So first of all, meftal is mefenamic acid, mefenamic acid, plus P stands for the paracetamol, so PCM. So mefenamic acid is about 100 mg plus paracetamol 250 mg, right? Then meftal spas, the meftal P, or we can say the meftal spas, right? Meftal spas P, they both have same composition, but the amount of the drug, these two drugs, right, these two drugs can vary in meftal P or meftal S, meftal spas P, right? Now the most common one that is used by the females is the meftal spas, but there's no P, okay? Only meftal spas. And this meftal spas, mefenamic acid is present. Mefenamic acid about 250 milligram, right? And there's also dicyclomine somewhere about 10 milligram, right? So this is a very good combination which is used most commonly by the female for menstrual cramps and abdominal cramps. So right, so this is all about the mefenamic acid. Now talking about the side effect, right? So we have already discussed about the side effect of mefenamic acid. Sometimes it is not well tolerated by the female, so you can have the abdominal pain. There can be also diarrhea. Prolonged use, like if a female is having continuously using meftal spas or mefenamic acid only, at prolonged use they can have this hemolytic anemia, right? Already the females are at a higher risk of anemia. Using the mefenamic acid at a longer for a longer duration at high dosage can induce the hemolytic anemia as well, right? So what to do in this case? So somewhere, if this mefenamic acid is not that well tolerable, then you can add the ibuprofen, or you can also switch to naproxen. But still there's another drugs which can be used, right, which is the PCM, right? Over here also, if you remember, we were using the paracetamol over here, right, for pain and other stuff. Overall the PCM is really very nice a drug, right, until unless if you use it in the limit. So this was all about the naproxen, right? So the duration of action, not the naproxen, it was the mefenamic acid. Overall duration of action was somewhere about 4 to 6 hours. Over here also we were using it for the dysmenorrhea, right? And overall the duration of action is much more better than the mefenamic acid. So so which one to choose totally depend upon the female patient, how nicely they tolerate such drugs, whether it can be ibuprofen, naproxen, or the paracetamol, or the mefenamic acid, or the combination of these drugs of meftal P, meftal spas, or only the meftal, right? So remember the dosage. If one more very important stuff, that for the PPIs, right, if there is a bleed or somehow if we need to increase the dosage, right, that if we need to increase the dosage we have to cover something to take care of the bleed. So in this case the PPI that we use will be rabeprazole. Again, how to choose a PPI totally depends upon for how long we need that PPI, again, and how potent we need that PPI. So PPI function the PPI function depends. So the PPI, how to choose, it will depend on two factors, right? Duration of action of the NSAID and potency required, and how much potency of PPI. These are the two main features that we look for, right? Because every single NSAID have different duration of action, different onset of action, so and so how fast that particular PPI start to function, and all those other factors that we need to take into account before prescribing somebody a PPI along with that particular NSAID. So for the case of mefenamic acid, it is rabeprazole. So again, one single dose won't hurt you that much, but if you're planning to take a particular type of drug for a longer period of time, you can use it. Again, it is still a safer drug as compared to other category, because these are not like so much severe cases that you've encountered for the GI bleed. It was much more common in cases of like The aspirin, the ketorolac, and the proxicam, these are much more at higher risk to cause GI bleed. The green one are at risk but still less than other drugs. So this was all about the mefenamic acid, right? Much more commonly for the female patients. Also males can also use it. There's no like gender discrimination over here, but mefenamic acid.